Good morning and good afternoon, everyone. Okay, so those who have already attended the session one, we have already met. My name is Sangeeta. I'm the Customer Success Manager with EON Reality India, and I also take care of the learning experience design. That is the content that goes into the EON-XR platform. So that is a little bit of introduction from my side. We are still waiting for a few more people to join, and we'll be starting shortly, maybe in next couple of minutes. So I request you to hold on, just stay there. Just for a quick recap, the previous session that we had as webinar one, we have discussed mostly about the technical aspects of EON-XR platform, like the different solutions that we have in offer and how you can create your own content using the platform and its features. So today we will put pedagogy before technology, and we'll be discussing more about the pedagogical aspects of EON-XR platform and how it can add value to your learning and training when it comes to medical content, especially human anatomy. That's the point of discussion today. All right, so I believe we can get started now. Okay, I hope my screen is visible to all of you. Someone can just give me a go ahead in the chat window, and I'll come back to the slideshow mode once again. Is my screen visible as a slideshow mode? Yeah. Thank you. Thank you so much. All right. So this is the second of this three-part medical webinar series. Today is the second part. Upcoming is the third part where we will be discussing more about the commercial aspects of the platform. So let's begin. Now, before we start talking about the pedagogical value of EON-XR platform, I would like to take a step back and understand what we mean by augmented reality, because this is a terminology that keeps coming during the discussion of EON-XR platform. So, augmented reality or AR is a relatively new technology that allows digitally generated 3D objects to be integrated with your physical environment. So right now what you are seeing on my screen is basically this human skeleton model on my physical surrounding. And this can be done using any of your smartphone or tablets or such devices. And using this, you can create very quickly, you can create and experience a totally simulating learning environment and create an hands-on immersive experience. And you can see that how quickly we can create our content using the platform, enriched with different kind of knowledge portals in the form of text, images, videos, PDFs, audios, etc. So the use of AR has been in the industry for quite some time. It was usually, in the beginning, it was most widely used in entertainment and gaming industry, but currently it's also widely used in healthcare sector as well. And due to the distinct learning advantage that AR offers, for example, remote learning or interactive simulations, or let's say injection of knowledge portals, like how we are using this audio based or this camera based recognition features that allows you to create content very quickly. For this advantages, AR is very quickly gaining popularity among healthcare learning and training as well. And to facilitate such kind of learning, all you need is an internet connection, a mobile device, ideally a smartphone or a tablet, and last but not the least, the EON-XR mobile app. We are available both in iOS and Android. So this is what we call augmented reality. We also support virtual reality and 3D. Today I'll be focusing more on augmented reality and its benefits in healthcare learning and training, with different examples of EON-XR solutions and basically the best pedagogical practices that it supports. All right. Moving on, we'll take a look at a little bit of theory. So the main goal of EON-XR platform in terms of learning is what? EON-XR's AR-based training basically provides a multitude of solutions, predominantly around these 6 areas that I have listed down. We try to simplify the delivery of complex information when it comes to medical content, try to advance the communication skills of the learners, enhance a sense of reality because we bring the digital objects into your physical surrounding. We also try to facilitate the use of large data sets that I'll showcase very shortly. We try to integrate virtual objects into physical spaces that we call a merged XR. So basically, you blend your physical and digital surrounding in such a way that the whole thing appears like one single entity or one single reality. And last but not the least, we try to enrich the comprehension of medical imaging techniques using the EON-XR platform. And in today's discussion, we will be looking at 3 prominent areas how healthcare learning and training experiences and learning outcomes can be enhanced by EON-XR in terms of knowledge and understanding, practical skills, and social skills. So we have seen that students who successfully complete learning activities by this EON-XR programs, they are more likely to achieve both enhanced theoretical knowledge as well as their practical skills. And this kind of AR-based learning essentially boosts the outcome in several main aspects of training, including professional knowledge, cognitive and practical skills, social skills, innovation, competence, creativity, etc. So let's dive in and see the examples in the 3 different domains which basically intersect and create a Venn diagram area that imparts the most effective learning through EON-XR. Starting with the knowledge and understanding that is promoted by AR learning. All right. So medical education is associated with an enormous amount of information, especially when it comes to human anatomy and bodily functions. So rather than being accessed via a traditional computer mouse, keyboard, and screen like we have been doing so far, AR can enhance the way in which medical students interact with the digital anatomical representation from different angles and getting a more immersive experience that ultimately aids in better knowledge gain and understanding. Like here we have an example in front of us. We are basically dissecting the human skull and talking about different parts through additional knowledge portals, right? So here we are talking about maxilla. We can have auditory information. We can have visual information in terms of videos or imagery, and that can be done for each part of the object. And again, when it comes to the playback, let's say here we are looking at this parotid gland and some musculature of the human head, right? So different concepts come with different levels of complexity, and how you gather that knowledge and how you develop your understanding is totally based on your learning abilities and your own pace. That is totally supported by EON-XR platform. Because we are into interactive content development. So the interactive content basically converts the classroom environment into gesture controlled knowledge surfaces. Like here you see that the gesture here is basically either you move around the object physically in a physical surrounding, or you can use your smartphone screen, swipe right, left, all the way, or you can basically zoom in, zoom out by pinching in and out. So your gestures decide what kind of learning you are going through and at what pace you are going through. And basically then in that same order, you are accessing the different knowledge portals through the gestures. And since you are totally involved in that learning process, fetching the data, playing with it multiple times and placing it in your desired location, it allows you to have a better retention and an increased memory. So therefore, when you have better retention, therefore I can say that we have reached better learning outcome when it comes to learning through EON-XR modules. We'll take a look at another example, how EON-XR allows you to have an enhanced learning environment. So you will see that we predominantly use two major functions to create our content. One is a text recognition and one is an object recognition. So in text recognition, you can basically spell out what you are looking for when you are creating a content. So let's say here we have started with a human heart, and we readily get the model in front of us in our physical reality, and straight away start creating the content based on the label or the name that you have decided. And based on your keyword search, it allows you to fetch text, image, videos, PDFs, audios, etc. And you can quickly create this kind of a floating knowledge portal. That is again gesture controlled, and you can literally move it from one location to other for better accessibility. Similarly, we have a feature that allows you to use image object recognition, or 3D object recognition rather. So here the heart that is there in front of you, you can use the just give me one moment. Yeah. So here in EON-XR authoring tool, we have multiple ways to basically identify an object and get the content based on that. This option is for your text recognition. You can either type it out using your phone keyboard, or you can just use this AI camera feature, which we are going to do now. So using the AI camera feature, you can capture an image of this 3D object and thereby get content based on that information. So imagine teaching a human heart with, let's say, a 3D model or a diagram or a chart or something like that in a physical classroom, and on the contrary, teaching a human heart through this 3D object that can be placed in your physical surrounding and can be manipulated in your own way. And essentially, again, just like your audio search, the visual search also allows you to fetch content from a rainbow of possibilities like text, image, video, PDF, etc. All right. So we know that different learners learn at different pace. All right. So and different people also learn through different types of intelligences. So when it comes to learning here, the modules are basically not controlled. So when a learner is going through an EON-XR module, it's like a multi-play module. So you can play it as many times as you want and have your own type of knowledge and understanding. Similarly, if we are looking at, let's say, the second scenario where we are talking about an operation theater.
So starting with the basics of X-rays.
And the different equipments which are a part of this operation theater, starting with an X-ray machine. So you can create knowledge portals in such a way that allows both visual and auditory information.
What I love about being an OR nurse is that I'm the ultimate patient advocate. Whether they're coming in here with a fractured wrist, we are fixing that wrist and they're going to be able to use that wrist again.
Preparing for a case, and we're going to walk in there how they keep track before the patient arrives.
One, two, three, one.
So here you saw how knowledge can be injected to every part of the operation theater, and also the characters like the doctor, the nurse. You can define the duties of each of the person and also assign content to each of the different pieces what they are used for. Talking about multiple intelligence, the modules that we create and deploy through EON-XR supports multiple types of learning, starting from spatial visual to auditory kinesthetic. So here we are looking at this hospital room or a particular ward scenario where we have the beds, we have the equipments placed in a particular order, in a particular sequence and in a repetitive manner, because there are like a multi-bed room. So here you can see that the entire experience is totally visual. And not just that, you can move around the whole space, the whole environment, and get an idea about your spatial surrounding. So it not only is supporting visual and auditory information through this, I have just muted it.
Go in and actually feel competent about managing a patient on.
Right. So every piece, let's say the medical ventilator, will have its own audiovisual information. And to retrieve those information, you will be moving around the environment in a kinesthetic way. using your smartphone or tablet, of course, and you will be having an idea of your spatial surrounding. So you can say that even people learning in different ways can be supported by the EON-XR way of learning, and can expect to have an effective learning outcome through that. And not just this, if you feel to customize your learning experience further, you can also have your own customized 3D avatar. Let's say when we are talking about a medical training, let's say we create a 3D avatar in the form of a doctor. If you're talking about a nursing training, we can always have a nursing uniform and appropriate mask, head cap, etc. If we are talking about an administrator, that can be done. If you're talking about a patient, even that can be done through a customized avatar creation. And then after creating your character, then you can talk about your module, and basically you can use any language, you can use your own voice to deliver a particular piece of content. All right. So when it comes to self-learning, self-evaluation is an integral part of it. We don't really try to score the learner, because it's a self-paced, very safe learning environment that we have tried to create. So what we have targeted here is we have created evaluation methods, but they are not really meant for grading the student. Rather, they can use it as a part of their learning journey and better themselves. So here, one example, we have created, let's say, a small quiz. So here you see we have the two models, brain and heart. Certain part of the brain is highlighted, and there is a question that is asked, and there are 4 options with a particular timer. So there is a little bit of gamification and challenge involved with the activity. We can always control this by increasing or reducing the time. And you can accordingly change your options or the complexity of the question. There are other type of activities like locate or identify. So locate is essentially you find a particular piece from a whole of an object. Again, you would see that there is, so you have to find, locate cerebrum, right? Just take a step back. Here. So for locating, what we are doing here, we are basically dismantling the brain into smaller parts, right? And then we are trying to find the cerebrum as a student. This is the selection, and then you can submit your answer. And you can see that it's not scored here. We're just getting a right or wrong answer. Similarly here for identify activity, which allows you to type in or voice out the name of a particular part, is also non-scoring when it comes to the external UI. So here I have typed in the correct answer. You can as well use the mic icon and spell out your answer. And at the end of all these self-evaluation activities, your student will be getting a personalized dashboard that will show how the performance was in terms of time, accuracy, correctness, and speed, etc. But definitely that is not for grading the student and allowing him to learn in a very safe and non-judgmental environment. Other scenarios like labs, let's say when we are talking about biohazard labs, when people are dealing with a deadly virus or a bacteria, or maybe some radioactive elements, or path labs or X-ray rooms, where training cannot be really implemented in a physical setup. Like you cannot really take all your learners to the real physical space and train about different aspects. So here as well, augmented reality comes in very handy. You simply create your learning experience, which can be viewed both in 3D as well as in AR. You can perform experiments. You can mix couple of different reagents. You can show here, like there is a warning sign which is appearing here. So we can show which is hazardous, which is non-hazardous, what is the function of each of the equipments. This is 3D versus this is the augmented reality. You can as well perform mixing reagents, change of color, and show the end product. So even the path lab biochemical tests are possible to be shown through augmented reality. So far we have covered different aspects of how EON-XR's augmented reality mode of learning supports in a better knowledge and understanding. Just as a quick recap, I'll take a step back and talk about a few things. So we talked about interactive classes because you are throughout interacting with your object, you are using your own gesture, whether you are moving physically in your surrounding, whether you are placing the object in your, let's say, table or the room or outside in an open field, and you are using the screen gesture to get the different type of content. So since you are interacting with the object in an augmented reality scenario, which is essentially your own physical surrounding, you are having a better retention and therefore an increased memory and a better learning outcome. Second, we saw that how text recognition and object recognition can help you create your content very quickly using EON-XR and basically create a much better experience compared to a real-time model exploration experience. So compare a model art, a 3D model, which is just a 3D model or just a diagram, compared to our augmented reality art that has a lot of information injected into it. And they're all dynamic. They're nothing is static. There is a video that plays, there is a audio that plays, and you can always control them, play, pause, replay, and learn at your own pace. Then we looked at the self-paced learning environments wherein you learn about
Focus Medica pioneers.
Whether you learn about human organs or you learn about something like an operation theater and the different equipments which is inside it, you can basically play it multiple times and allow yourself the necessary time to completely learn and understand. Next, we have looked at how the XR learning supports in different type of learning abilities and supports students with multiple intelligence. So we support spatial, visual, auditory, and kinesthetic sort of learning, and therefore basically there is something for everyone, for every type of learner within the platform. We also saw how you can customize your lectures for your learners through customized avatars with customized languages, and the way you move basically is captured through the avatar animation, which is a back-end automated system. So however way you point your mouse or let's say your touch screen towards a certain object, that will be captured and presented through this 3D avatar based output. We also saw how self-evaluation can be performed once a student is going through a learning path, and this is not for grading the student, but also but to help him further in the learning process. And we also saw, last but not the least, that how in hazardous situations and chemical labs, biohazard labs, or X-ray rooms, and certain other similar conditions, how we can use augmented reality to train our students. All right. Now moving on to the practical skills that augmented reality can enhance in your learner base. Okay. So in general, it is an expectation that medicine graduates have inculcated not only extensive and in-depth knowledge about the human body, diseases and procedures, but also communication skills, physical examination skills, practical skills, and clinical skills. While the current medical pedagogy and curriculum are undoubtedly doing a good job in delivering competency-based medical and healthcare professionals, there is still room for improvement in terms of the practical and surgical skills during training, face-to-face patient care and treatment, etc. So here our augmented reality can play a major role, allowing the students to practice multiple times for a particular skill and learn at their own pace. So here, this is one example how to perform a CPR, for example, right? So for a learner who has learned the technique but is still looking forward to practice it further, how can we implement that? So here AR comes really handy. You can create a simulation. The entire room is simulated. The 3D environment is the OT, the emergency room. There is a person who is performing the OPR, CPR. There is a person who is receiving the OPR, CPR, and there are additional information presented in the form of floating knowledge portals. So you can have information in the form of a video, like in which condition the CPR is to be performed, or if there is no medical professional present around, how alternately you can do that, or who else can do that. What is the expertise that you require to perform a CPR? So this is basically an end-to-end learning through knowledge portals and also through personal practice by the animated 3D or the 3D character, which is this doctor here. So this is not just for CPR. When it comes to other medical trainings, let's say a surgical procedure or something that has to be done step by step, this kind of AR-based solution can come in very handy. And it allows you to gain and sharpen your practical skill in a much more interactive and immersive way. Moving on to another example where we are seeing this operation room surgical procedure education and training. So currently you are looking at the 3D scenario. We have this OT room equipments, and we have this nurses, doctors, and there are other surgical
protect workers by
stuff
containing
as well.
vapors, dusts,
This is the
gases,
fume
and
hood.
fumes generated within the hood and removing them as air.
All right, you can see that the fume hood is kept here. We are still looking at the 3D UI of the solution, EON-XR solution. There is an X-ray machine, there is this fume hood, and the audio will be talking about each of them, explaining their functions. And now we are looking at augmented reality. So basically our modules, all of our modules that you create and deploy
Now
are
we want to show you how to
compatible
properly move.
in 3 modalities. You can see them in 3D, which is your desktop screen or your mobile screen. You can see them in augmented reality, which is essentially your smartphone or tablet. And last but not the least, you can see them through VR, which requires head mount glasses like HTC Vive or let's say Oculus Quest. So we'll see it once again. And this kind of AR, VR based programs are prominently used to improve practical skills and the performance of the surgical techniques. And compared to conventional training, medical students that receive the AR version generally tend to exhibit a higher level of learning and tend to make fewer procedural errors than others who have not done this kind of simulated practice.
Fume hoods protect workers by containing vapors, dusts, gases, and fumes generated within the hood and removing them as air flows into the hood and then out via the laboratory exhaust system.
Now we want to show you how to properly move the C-arm in and out and end up in the same place. The classic part of this whole story is that I just learned this trick last year, and I've been a radiographer for well over 35 years.
Moving on to another example of how XR can help you sharpen the practical skills through its simulated learning. We have this example where we are doing an IV insertion training for a human hand. And this can be done in both AR and VR. So usually a lack of extensive hands-on training can often hamper the ability to master an otherwise simple technique like this IV insertion. It's pretty straightforward, like we get it done for every simple test that we do. Now, through EON-XR, you can basically practice this multiple times through a simulation before administrating on a real patient. So here you can see the AR basically superimposes the arterial system, arteries and veins. So it's easy to find the right blood vessel that you are looking for and practice multiple times just to avoid errors. And then finally, deal with a real patient who needs this kind of an IV insertion. All right. Again, a little quick recap of the practical skills that we have discussed. We have discussed about how simulated trainings for surgical practices or other clinical procedures can be achieved through EON-XR training and allow you practice multiple times to sharpen your knowledge. We also learned that how AR/VR based programs can reduce procedural errors once you go through multiple rounds of practice in an augmented reality based safe learning environment. And we also saw simple procedures like this IV insertion, intravenous insertion can be achieved by practice and before once someone actually injects a real patient per se. All right, moving on to the third and the last segment of our discussion, that is how AR can enhance the social skills among medical practitioners. So medical training involves extensive learning about social interactions and human behavior. So as future practitioners, I'm talking about the medical students, they are expected to perform their duties across a vast spectrum of healthcare settings. Augmented reality solutions in XR, EON-XR provides a unique opportunity to prepare the trainees for complex social situations in a controlled and managed environment. So here you can see there is a situation, we have simulated a situation of a conflict management at workplace. So we expect the healthcare professionals to not only take care of their knowledge and understanding as the solid base, not only their practical skills as they practice more and more to make it perfect, but also their social skills, so they are more capable and equipped to handle a conflict scenario in workplace, with colleagues, with patients, with the patient's family or such things. So this kind of situations can very well be simulated through EON-XR platform. You use the same set of solutions, but use it in a slightly different context. Another example is in social skill is that you learn to work with a team. All right, when you are doing it alone, there is a separate sort of learning outcome. But when you are doing it in a group, performing within a group, you basically are nurturing both intrapersonal as well as your interpersonal abilities. And several studies have shown that AR in medical training on students, they experience a better learning outcome and better social competencies and a better teamwork ability compared to people who learn in a solo. So this is one simple example where we have been dissecting a particular organ, a human organ, and doing it in a group. So people take turn to dissect, to explain, and to talk about their opinion, and then wait for their turn, then finish their turn and pass it on to the next, and then basically collaborate and communicate as in how it is required. So this can be very well utilized when it comes to a brainstorming session before, let's say, a complex surgery or something unique that may have come up, or where you really feel the interpersonal skill is really necessary to nurture. So far social skills, we have examples where we can deal with scenarios of conflict management, or not necessarily conflict management. If it is like to deal with a particular type of patient, also can be done through AR-based trainings. And last but not the least, the interaction-based communicative and collaborative learning can also be nurtured through EON-XR. That basically goes back to brushing up your social skills as a medical professional. Now, so far we have looked at how the learner can be benefited by the augmented reality-based solutions in EON-XR through the three different modalities: knowledge, understanding, practical, and social skills. Now we'll take a quick look, maybe spend next 5 to 10 minutes understanding the pedagogical values from an author's standpoint. So author is essentially, let's say, a teacher or a doctor who is preparing their modules for their medical students. So you can do quite a few things from the point of best pedagogical practices. First, let's start with chunking of content. So here in front of you can see that there are three human organs. One is the human lungs, one is this brain, and one is a human heart. So we can decide whether we want to chunk it as a modular learning experience or a comprehensive learning experience. This one essentially is a comprehensive one. So I have added three models into my physical surrounding. You're basically looking at my desk, and I have added information to each of the three pieces.
The trachea divides into...
So I have information about human lungs in the form of video, image, text. Then it's my human brain anatomy. And I have added just one piece of information for cerebrum. That again can be done through multiple ways: image, audio, video, etc. And we have information about human heart as well. So it is totally up to the
It's Professor Dave. Let's
author's
look at the heart.
author's choice whether they want to create a modular structure or a comprehensive structure for their learning experiences by adding one object or many and chunking your content accordingly. Okay. Now, when it comes to best pedagogical practices, we always talk about learning outcomes, creating and designing effective learning outcomes. So usually we still tend to follow Bloom's taxonomy when it comes to deciding clear and concise learning outcomes or objectives. So XR platform allows you to create a learning objective for each lesson that you create. And it's always editable. So you can define your objective in such a way that the student knows what he or she is going to achieve at the end of the course. And not just the lesson, like this kind of a lesson with many knowledge injection points. You can also add an additional lesson material in the form of, let's say, another video or a PDF or a quiz or a questionnaire, or maybe just some kind of a job aid. Any kind of material can be added here. Just paste the URL of your file. Now, we know that learning can be modular, but still we have to somehow pack the modular structures into a course structure, right? So that course structure is also supported by the EON-XR platform design. This is something we call a playlist. So here I have actually tried to create a quick demo of how to create a playlist, right? So we have like lots of human skull related lessons in the platform. For example, when we are talking about head and neck anatomy within human anatomy. Now what I have done, I have created a playlist named Different Views of Human Skull. Okay, yeah. And then I will keep on adding the lessons to that particular playlist. Please excuse my subject knowledge as I'm not a medical professional. So I've just named it as a common name, Different Views of the Skull. So I'm going to the lessons that I feel are suited for that particular module or the course and adding them one by one once the playlist name has been defined. All right. Now there is a personalized dashboard called My Workspace. So this is a place where all of your work will be stored, not published though. It is like your personal space of all your work sits unpublished. And once you publish, it becomes available to the rest of the members of your institution. So once you come to the playlist, then you will be able to see this, the new one that we have just created. And see here, under Different Views of Human Skull, I have this front view, lateral view, superior view, and posterior view of the skull. Right? So that way, let's say I can talk about the entirety of the skull anatomy from the different viewpoints. And I can reorder them. Like if I want the posterior view to come before the anterior view, the superior view, I can do that as well. So this playlist structure is something like a course that allows you to package your smaller modules, which are otherwise very quick, very small bite-sized learning modules into a learning journey or a learning path. Next comes the category management. So we understand that the requirement of different organization and a different teacher is totally unique. So what you can do, your institute is something that you can design in your own way, in your own custom way. So there are two levels of hierarchies. We call it a parent and child hierarchy. I'll just give you an example. Here. So we have something called all categories. So when you are looking at the library of our EON-XR lessons, you would have this major categories, let's say human anatomy, language, etc., etc. So human anatomy is called the parent category or the master category. Now, once you click on that, you get a list of subcategories, which we call child category. So basically hierarchy 1 and hierarchy 2. And then when you come to a particular subcategory, let's say neuroanatomy here, you will be able to see all the lessons and experiences pertaining to neuroanatomy. So this is what we call a parent-child category view. And it's an optional design. If you wish to have like a flat one level hierarchy where, let's say, you have your upper limb, lower limb, pelvis, perineum, abdomen seen just on the top layer. That can be done as well just by unchecking this box. So we can have either a two-step or a one-step hierarchy based on your learning requirement. And these categories can be named, defined, and managed totally by your organization. It doesn't have to be anything preset. And later you can define, like under a particular category, let's say human anatomy, what are the child categories that you want to put? Whether you want to add something more or you want to remove something from the parent. So totally customizable design within the platform. Not just the category, you can also create something called a level. Let's say if you have first year program, second year program, or first semester, second semester, etc., you can define them into such levels. The names are customizable, and this is a very handy feature. So later, let's say you have a lesson that you wish to assign to one group of students, maybe a group of 1,000 students or 100 students. So what you can do within the first semester group or level, you can actually pack all the students, and the moment you assign to a group, it gets sent to all the 100 or 1,000 number of students. And not just this, to get the learners' usage data for every lesson, we have been emphasizing that we don't encourage the score system, so that we don't want to show like what kind of performance the student has. We kept it as a self-evaluation method. But when it comes to knowing that whether your lesson has been used or completed by a particular student, you can always get the lesson statistics for each and every lesson. So you can see the name, you can see the date and timestamp, you can see the number of attempts that the student has made to that lesson, and the number of the time spent, whether he has completed or not, etc. And you can also export the same information as a CSV file. So as a teacher, you would be pretty much able to track the lesson statistics for each and every experience that you create. One more important thing that you can provide to your students as an author or a teacher is that enable the editor's choice option. So you can handpick some of the lessons. You see the star mark lessons, they are like handpicked, selected lessons by SMEs. So as an SME, you can always keep those layers, those lessons on top, so that your students know that they are the most effective ones, both technologically as well as pedagogically. Again, it's an optional function. I'd like to talk about the learning tool interoperability, or the LTI advantage. So LTI, EON-XR allows you to integrate the XR lessons into your existing LMS platform. Let's say you're already using something like Moodle or Canvas or such things. So we have a scope within the platform that we can create individual LMS roles. So let's say we have 10 roles that can be created. So you can define the name of each role, and you can define the weightage. And based on that, you can assign people different privileges and responsibilities within your LMS. So the content can directly viewed from your existing LMS without navigating outside. And that way you can even create a better learning path. Like I was talking about this playlist function here. So playlist is just one option within your LMS. Let's say you have this playlist of different views of the human skull. And along with that, you can insert some kind of quiz, some kind of other instructor-led material, videos, or some physical classroom training methods, and create an end-to-end learning journey using your own existing LMS. So all this that we have been discussing so far, we have like a foolproof 9-step implementation process. So all this will be basically provided in the form of extensive trainings, hands-on training. So you will learn how to create your module, how to add different pieces of information, or how to integrate your courses into your existing LMS, etc. So this is so once you are a part of EON-XR family, we take care that the entire training is completed end to end, and you are able to use all the features comfortably. So that's pretty much. Thank you for your time and patience. I think I'll stop now and we can open for any Q&A. You can type it in the chat window and I'll be answering it because you will be not able to talk. So you can please type it in the chat window and I'll answer them one by one. We have next 15 minutes, so you can take your time and just for a quick recap, since we are here, I'll just take 2 minutes to recap what we have been going through so far in the last 40-45 minutes. So this was the second part of our 3-part medical webinar. We discussed about the pedagogical value adds of the EON-XR platform in healthcare learning and training. We learned about what is augmented reality and how that can change the face of learning and training in medical and healthcare, and how easy it is to use EON-XR Medical solutions by just having a mobile device, the EON-XR mobile app, and a good internet connection. Then we talked about the 3 aspects of learning: knowledge and understanding, practical skills, and social skills that can be enhanced by EON-XR. We started with knowledge and understanding. We saw the different examples of interactive classes that allows you to basically use gesture control techniques using your smartphone or tablets, fetch the knowledge portals, play it in your own way, in your own pace, and therefore get a better retention and memory. We also saw how this text and image recognition features allow you to create a better immersive learning experience than like the traditional 3D models or charts or drawings or diagrams, etc. And among knowledge and understanding, we also saw that how you can learn at a self-paced, self-controlled environment, right? Like nobody is really rushing you. You can play, pause, go back, learn at your own pace. We also saw that how multiple intelligence is supported by the EON-XR learning modules. All the different type of learners can expect an effective learning through the XR-based learning solutions. And we saw that the avatar-based customized design can help you create your modules through any regional language, in any accent, especially which is most comfortable for your students. Because if you are the teacher, you are the best person who can convey the matter to your students in your own way. So supporting that, we have this customized digital 3D avatar design that can help you in your customized training. And in terms of self-evaluation, we saw that the students can use the self-evaluation tools as a part of their continuous learning process, and not just to be tested by the teacher, because we have other techniques to test the student. We really don't want to bring it within the platform. The platform, we always intend to keep it a safe learning environment where people can come back, practice, learn, enrich their understanding, and come back once again. We also saw situations like this hazardous labs, path labs, X-ray labs, etc. How the training of such things can be given in a safe scenario without any, health hazards or accidental hazards in terms of chemical explosions, etc. In terms of practical skills, we saw situations like CPR training or other physical examination skills, how it can be honed using multiple practice simulations using EON-XR platform. And not just you practice with the animated moves, but you also get additional information in the form of the knowledge portals. We saw this operation room surgical procedures training, not only the surgical process, but also the equipments, the roles which are involved in the entire process. You can basically add information about any piece that is associated with the entirety of the 3D environment. And we saw simple things, simple techniques like IV insertion, how that can be perfected by multiple practice using the EON-XR solutions. Like you superimpose the arterial vein system on the human hand and then basically find out your right artery before you start injecting a real patient, and have as less errors as possible. In terms of social skill development through AR solutions, we saw that how XR can help you practice conflict management at workplace with patients, or with the family of patient, or maybe with your colleagues in different ways. So you can create multiple simulations and give multiple different experience of different scenarios. And here, you literally don't have to fight with anyone in a physical setup. You basically learn it in a safe environment where no one is judging you based on your decision. And then also, last but not the least, we saw that how you can perform as a group and as an individual, and sharpen both your interpersonal as well as intrapersonal skills. And basically learn to handle the social aspects of your job as a medical practitioner. Okay. From the author standpoint, we saw that how you can chunk your content either as a modular or as a comprehensive lesson, like have one object or multiple object. You can add desired learning outcomes. You can add lesson materials to each of your experiences like this. You can create playlist to create a course structure and package basically multiple lessons within a single playlist. So your students get it like as one assignment, and they know that this is the learning path. After I have learned the front view, next I should learn the lateral view of the skull, and then the superior, then the posterior, to get a holistic 360 idea of the human skull anatomy. Just an example. Then we also saw how you can basically customize your categories, customize your levels, and basically get data for the usage of every lesson by every student. And last but not the least, we had LTI setting, which is a very important and useful feature within the XR platform. So you can integrate your existing LMS and the EON-XR solutions with each other. Okay, thank you. Thank you so much. I'll share my email ID here. In case you have any questions, you can come back to me later as well. You can mail me anytime. And also, I'll give you the support email ID in case if you have started using the platform, because we are available for free. You can actually use the desktop or the mobile app. For mobile app, you can simply go and download from the App Store or the Google Play Store, and you can start using the free version. You should be able to do mostly all the experiences. You should be able to play that I have shown just now. And if you have further questions, you can always reach out to me, or straight you can reach out to the support team. Thank you. All right. So if we don't have any more questions, I think we can call it a day. And we look forward to having you all in the third and the last webinar of this session. All right. Thank you once again, everyone, for your time and patience. I really appreciate the participation. I hope you have received the registration link for the third webinar as well, Mr. Sparrow. So if not, please write back to me or the support, and I'll be happy to share the third webinar link as well with you. All right. Thank you once again, and see you. Bye-bye.